and in the studio for the Newsmakers segment is Dade County Executive Ted Roman. He comes in every Thursday, a representative from the county government, to talk about things that are going on. Good morning, sir.
Good morning. How are you, Evan?
Doing good, doing good. We got another hot day on tap.
Yeah, I know. Yesterday was miserable.
It was miserable.
Yeah. My truck had when I got in the truck yesterday evening. Of course, it'd been sitting around all day. It was 103 on that little thermometer in there. So that's the most I've ever seen it in.
Wow.
It was terrible. But we've got, this month or the next month, maybe fall will start easing in on us. Hopefully. And also the rain. We've had so much rain, it's hard to keep the grass mowed, as most of you know. Just every week, But it's that time of the year, We'll be wanting this probably around February. We're wanting some
Absolutely.
Some heat.
Absolutely. Yeah. Well, appreciate you coming in. We've got several things to actually talk about. Let's talk about, you're going to be meeting in a special call meeting today at 4 o'clock. Got a couple of things on the agenda. I believe you got an appointment to one of the boards you've been looking for.
That's right. And also the appointment. And also we have Miss Bradford to call this. She's been working with the alcohol board there on some things, some issues that they've been having, and with Robin Rogers, and she's wanting to go with that with us. Of course, we can't talk in a room without it being either a meeting or a work session or whatever. So all the commissioners, we were going to do it like Monday or Tuesday, but all commissioners, one or the other, had something to do, so it'll be today at 4 o'clock. And
I know the Alcohol and Beverage Board met last night and went over that. From Ori was there, I know.
From
here, he attended that meeting, and they're going to be presenting, from what we understand, later on this evening. And it pertains to a couple of different things. It pertains to outdoor events.
Yeah.
And then it also pertains to like wedding venues and things like that, to be able to have a licensed, insured, and person to be able to sell that would be responsible for selling the alcohol.
Yeah.
At those type of events, a bartender, if you will, and they're licensed and bonded and insured.
Yeah. And so anyway, it'd be more of a listing session, I think, and she's got a little PowerPoint I think she's going to do. But I want to remind, of course it's open, of course, to the public, but we are back on our COVID routine again there in our meetings, any meetings, whether it's the water, whether it's our the beer board or whatever. We're stressing the mask, try to wear a mask, and also we've got our seating capacity in our room stretched back out because things are going the wrong way there on the COVID, as we'll report this evening at 3 o'clock on our report. But it's you're welcome to come. It's not a problem with that. But or you can watch it. It'll be live streamed.
So you're not anticipating a vote?
I really know. It is a meeting.
I guess it could. You could have.
We
one.
could have if
because
everyone.
It's a fully
called. It is a meeting.
Special call meeting.
It could be a vote.
So you could get a vote on the ordinance.
Yeah, but there's a lot to look at. There's a lot. There'll be a lot of questions from the commissioners, I'm sure. So whether that happens or not, that'll be up to the commission. It's just. But anyway, that's at 4 o'clock. But as I said, our building. We had to shut down the tax commissioner's office there. Hopefully she'll be open back up Monday. She thinks it'll work out. Right now, people are having to stand out there at the window because it was actually brought in or reported to us. The state auditors, one or two of those people that had been there all the week before did test positive, and they did notify our building, our office, and the tax commissioner's office. We do have one person in the tax commissioner's office that's sick right now. They do have the COVID, and we've tested everyone else in there, and they did come back negative. We'll probably do another test probably Monday because sometimes it doesn't show up for several days when you are actually around the person. So we just want to be sure that people we want to be safe for our employees, and plus be safe for anyone that comes in and out of that building. We have a lot of activity in our building, in and out, and so we just want to protect everyone involved. We are spraying. I have a sprayer there in my office. Alex takes care of it. We've got several different areas there that we do spray down twice a day, sometimes more than that, in just how much traffic. So we're doing everything in our building and our facility that to try to protect everyone. So.
Yeah, I know that you, of course, our middle school and high school went back today on a half of the alphabet goes on Thursday and Friday, and the other half goes on Monday and Tuesday to maintain some type of normalcy, to be able to do that. But I think they've seen some where parents have sent children to school sick, and that should never happen.
It should never happen. No.
But
school superintendent will be on today.
That's right. We'll have Josh Engel there on our 3 o'clock report today. So tune in there. He'll have some news about what their plans are next week and next. So be sure to watch that. Yeah. But that is right, Evan, and that's. I mean, it's just that's. I keep saying sometimes, common sense. Use common sense, but you should never. I don't care if they've got the sniffles or whatever. You should never let a little fellow go to school. And then maybe with a fever or sick, you just don't do that, because you no telling how many people you could affect, by that. So,
especially now, you and I were talking yesterday that a very unfortunate fact that you had to spend some time with your mom in the hospital here recently, talking with one of the nurses there. You take the pandemic out, take it completely away. Just like the businesses here, whether it's the Dollar General store or some of our leading industrial folks, they're all looking for employees, and the hospital is the same thing.
Way.
They're looking for, they need employees because, the demand's up because of the pandemic, but they're still needing employees if the pandemic wasn't even there. It's
not that they don't have the rooms. It's actually they do not have the RNs and all to man those patients to take care of them, and it's scary. I didn't realize how bad it was till we were up there all those days with my mother and saw what really was going on, and it's really scary, to know that. But that's what's happening, and it's not so much that the rooms are full. It's more like you just said, they can't get the employees, and it's that way in a lot of different professions, right on down. Our road department, we need to be paving right now. We're going to have to hire paving done on a lot of our paving this year, because we do not have the manpower. And we have tried everywhere. We run every ad we can. We pay good money. We've got good benefits. But it's hard to find CDL people, CDL drivers that will work. We're down 3 people right now on our road department. And it's right here at home, good benefits, good insurance, But it's that way, like you mentioned, even our fast food restaurants and all. It's just I don't know what we're going through. It's scary, and it's all through the whole country.
Well,
if you watch the news,
I guess we talked about it here on the program, where it's a good and a bad problem, because the economy, as far as what we produce here locally in this region, seems to be booming.
Yeah.
Wages have increased. You've got fast food places that were 2 years ago paying just above minimum wage, and now they're up to $14 and $15 an hour for fast food.
Yeah.
You've got places that used to pay 10 are now paying 20, and then you've got some places that'll give you a $1,000 sign-on bonus if you just come to work.
Yeah.
And so because they have so much demand for their product.
Yeah.
And which is a good thing, but then of course the other side of it is you can't find the employees.
Can't find employees to pay. They're not wanting to work, and I don't know how some of the people are getting by. I really don't.
We can tell by our unemployment. There's not that many people in the counties even drawing.
That's drawing unemployment.
I think the thinking for a long time was all these people are drawing unemployment, and that may have been true back then.
Yeah.
But Tennessee, Georgia, and Alabama doesn't give any extra on unemployment any longer.
No.
They stopped that back in, I want to say June, I believe at the end of June.
I think it took full effect in July the 1st, I believe, when it went in. I know Georgia, that's when. And also, I think now you have to prove that you're looking for work,
Absolutely.
You know, when you go out in the job
You know,
market.
I told someone the other day, if you needed a job, you could walk through Trenton and should be able to get 10 jobs just walking down the street.
That's really right. Yeah.
If you started at city limits on the north end and walked to the south end,
Yeah.
with the industrial park and all of the different stores and the fast foods, you should be able to say, okay, I got 10 jobs. Which one do I want to take?
Yeah.
You know, and there again, I guess that's a good problem to have, but it's also it's hard for these companies, as we see some of them. The fast food places are closing in the evening. Some have been closed for a week. Some of them don't have lobbies open. It's all because of having employees, for sure.
Also, you know, I want to talk about too before I don't know how much time we got, but our health department does have plenty of the vaccine. You know, they have the Pfizer and also the Moderna, so there's no reason, and there's no lines, you know. I mean, there's no reason if you want to get vaccinated to be vaccinated. The big problem that we're having right now is the testing. The only free testing that we have right now that you can actually drive through and be tested is over at the Colonnade, which we mentioned that last week. The Health Department, Northwest Georgia Regional Health Department, they do have that open yesterday, Wednesday, and it's they actually are staying open Monday and Wednesday. Is that right? 2 days a week?
Monday and Wednesday,
Yeah.
from 10 to 7.
From 10 till 7. So, you know, it's from 10 o'clock in the morning till 7 at night. So if you're in that
And this
area,
is a drive up.
it's just a drive up.
Right.
You're tested there, and you can move on. You know, it's you don't have to go in. You know.
I know we were talking earlier, you know, this morning I was, and I told them that you were trying to get free testing reestablished back here in Dade County, but you know, it takes a little while to get.
Well, the health
moving.
department is there again. You know, it's having the people to do it. You know, they really are not. I mean, I'm talking about the Northwest Georgia region, which is out of Rome, which is our district. They're hurting for employees. You know, we're down a nurse in Dade County. We're actually looking. You know, they're trying to hire another nurse because we were down one. But and what they're doing over there is they're actually subbing it out. They got, just like they did on the last license we had over here. They got a subcontractor coming in taking care of that. But what I did was put the two people together with primary and our health department, and it's up to them to work it out. You know, I know the health department is trying to step up and maybe furnish kits for them, and I don't really know how they're going to work it. But then they've got the mobile units, you know, down at primary that are really nice units, and they're the very ones that's been going down to our full fields, you know, and giving the vaccine down there.
Well,
So,
and hopefully they can work together. I mean, you got a state
I hope
agency.
so. I know something probably, you know, by Friday anyway. You know, by Tiffany.
And you and I both know that the Primary Health Care Center is a federal agent. It's a federally funded agency to provide low-cost health care. So if they can,
with your tax dollars,
right?
With your
So if they can use their vans and be able to do some of the free testing along with giving out the shots, that would be that'd be great to be able to combine those.
Exactly.
You know, where they could do that. So
and there's other places here in Trenton, you know, you can be tested. Of course, it costs you. You know, I mean, we've got the Lawson Medical up here, you know, and also, I mean, you know, like primary, you know, they're doing testing, but you know, you have to, of course, make an appointment. I think you have to go in and all that. But we've got the place here in Tiftonia. A lot of people go up there and to be tested. I think it's $90, you know, straight pay. But the lines have been so long up there. It's amazing, you know, how many people they're worried. You know, they want to be tested. They want their children tested, the parents or grandparents. You know, so. Right now, that's a big deal, you know, especially with schools turning out like they are and going on their different schedules. But as far as the vaccine, there's no reason in the world right now that if you want to be vaccinated, that you can't. The boosters, from what I understand, they're just right around the corner as far as giving you the booster shots. Right now, I think they are administering them to people that have, you know, respiratory problems or whatever. What's the word for that? Underlying conditions, yeah. They have started that, from what I understand. And so, but I think it's just going to be readily available probably by the middle of next month. Or
Well,
by
the
first
FDA
October.
has finally approved all of the vaccines,
Mm-hmm.
and they just had to wait for a time frame to
Yeah.
be able to do that. So they're all fully approved.
Yeah.
The vaccines are available free of charge.
Yep.
Now, as of this morning, just over 60% of the eligible folks in America have had at least one shot. But in Dade County, we are way behind.
Yeah.
We're struggling to get 30% of our folks vaccine of at least one vaccine. So
Yeah.
we're half of the national average here, and we've got
Yeah.
to, now that it's approved,
Yeah.
and it's just like any other type of drug that you would take or a vaccine that you would take.
Yeah.
Hopefully, the folks that have been holding out
Yeah.
will go and get those done.
I hope
Get that
so.
done.
It's just it's really scary. You got people that are kind of blocked it out. Especially some of the younger generation and all, and that's their business. But you need to look around you and look at some of these people. That families that have lost people just in the last week or two that we've known all of our lives that and lost their loved ones to COVID.
Absolutely.
So believe me, it's real. Trust me, it's not. It's out there, and it's not getting any better. I'm telling you, it's.
Well,
it's
one of the things I guess we also need to realize, there's been a great number of folks that have had it and recovered, so they have the antibodies, and maybe they've chose not to get vaccinated on top of that or whatever, but they are, I guess, from what we understand, somewhat protected for a period of time anyway.
Yeah.
But the vaccines are fully approved.
Yeah.
So
Exactly.
and they're fully free. Probably not great terminology and grammar there.
Well, I'm not
but
sure.
They are free.
I'm not
and
sure
they
about
are available.
the Moderna. I'm not sure about that yet. I know that's what I had, and I know it's just around the corner, but I'm not sure that they've actually approved.
I thought it was
FDA.
the Moderna.
They completed their submission.
Yeah, it'll happen. I mean,
Yeah,
it's no.
and
no
from
reason.
what I understand, it's only because they
Yeah.
had to wait a certain length of time.
That's right. And
to
the
get emergency approval from what I
the
was
Pfizer
told,
was the
was
first.
2 to
That's
4
they were
weeks,
the first.
2 to 4
Yeah.
months.
So
To get full approval
Yeah.
has to be 6 to 8
Yeah.
with data, and
So-
it's just all collecting data.
yeah,
And so they wasn't holding it back because they were concerned. They were holding it back for a time frame.
Yeah.
And that's
Yeah.
what
That's
some of the
true.
reporting's been anyway.
yeah. But
So-
but it's out there, and I just hope more people do step up and get it. As I said, I kind of held off there after I had to about getting mine. You had to wait so many weeks or whatever, and then I really was kind of hesitant a little bit till I really realized that, because I thought it was kind of like the flu shot. They were giving you that bacteria or that germ in you, but it's not got anything to do with that. It's a medication that they've actually came up with that they're injecting into you to fight this off. So it didn't affect me hardly at all. I had a little fever, and felt bad the first day or second day, but it's like a 48-hour thing, and then I can't tell
Well,
anything.
myself, I didn't even have any of the symptoms. My arm was sore
Yeah.
both days. That I had the 2 different shots, but I didn't. It really didn't. I couldn't really even tell that I had a shot.
Yeah.
Other than my arm, I definitely
It was
felt
sore.
it
Oh
there.
yeah. But
For
the people have had it. A lot of people, there is side effects. To the actually after you have it. I've not gained my taste back or my smell.
So you,
I had it back
you
in
actually
January.
had.
I had the and it's strange. It's hard to get used to that. Not being able to taste or smell. Every once in a while, you could taste a lemon or something like that. But what's the strangest thing is, and I've read some of the people that's had this too. Every once in a while, it's just like you're in a room full of cigarette smoke. It's the strangest thing. I've never smoked, but it chokes you. I mean, coming down here this morning when I came around the square, it was just like my truck was full of.
Real quick, I'm sorry, I got 30 seconds.
Oh, no, I'm
here,
sorry.
so
I got to talk about that.
I want to get your number out before we have to.
Yeah, it's 423-667-8999 is my cell number, and 657-4625. That's our office number. And you call me if you have any questions, and if I don't have the answer, I'll get them for you immediately. And we're here to try to help you. That's what we do. All the commissioners, we're public servants, and that's our job. We work for you.
Dade County Executive Ted Roma here every Thursday to talk about county government. We thank him very much for being on the program. 3 o'clock they'll have their Facebook Live update. 4 o'clock they've got their special call meeting this afternoon that we'll be covering here, of course, on KWN and the Mountain Valley Independent. Have a great day, everyone. We'll have another edition of KWN Today coming up tomorrow right here on KWN.